systematically, including some of the European stuff and some of the NIHR angle on how to access these studies and how to see what's going on, and we'll come on to that. So mine are mainly non-cancer, that's what I do, and I've got a few to go through. The first one is, there we go. Thanks. So there's a list there, but we'll go through this. So this is a study that's just getting started, just going to ethics. Your centre is involved in any Crohn's disease surgery, as almost all colorectal units in the country, you could open for this, and it's around enteral nutrition, which is proven to work in kids, but in adults there is a big evidence gap. And the HGA commissioned this, and it was funded about 18 months ago. Enteral nutrition is this: we all recognise these as surgeons, and essentially you have just that for 6 weeks pre-surgery, and there's some evidence that it makes your outcomes a lot better and a lot safer. So it's a randomised trial in anyone having any Crohn's resection of any sort, small, large bowel, redo surgery. We need about 600 patients and 40 units. We've cleverly tried to design it to link in with big Crohn's disease study. There's not been a lot of IBD research, and then all of a sudden we've got quite a few things going on at once, which is great. From the back, I apologise, but essentially randomised to have your normal preoperative kind of workup or have 6 weeks of EEN. And the primary outcome was nice, and we're funding a lot of trials like this now with a patient-reported outcome and a more objective outcome of complications index. So we're also looking at compliance and whether it matters how much you have or not, and cost effectiveness and things. Started, if you're interested, I think it's pretty nice and straightforward trial. Just alluded to this. This is from Steve Brown and Laura. This is a surgical technique trial in theatre, how we do the join in a Crohn's operation, answering two really important questions and new techniques that have come along without a lot of evidence. 2x2 design, whether you get neither one or both of the interventions. Ileocecal resections and who are being joined up, essentially. But it's to remind me to say that on table you decide if you have equipoise. A lot of surgeons are a bit worried about this study because they don't know up front from looking at a scan whether they can do all 4 of those options beforehand, and they're not recruiting patients. But it's designed that you consent the patient, and if on table you have equipoise, you have the length and the pathology, anything that will be allocated, you then phone the randomisation phone number and you get allocated. It's an important study, but it's a difficult study, and it's running behind a bit at the moment. I don't think there's any Welsh centres. I may be wrong. Are you doing it in Cardiff? So they are definitely wanting 300 patients, and they want more sites to get involved. So it's one to think about. You may have heard about this study before because we've been talking about it for about 4 years. It's finally happening now. This is a really nice observational study looking at treatment of parastomal hernia. Their specialists to be the lead at their site, to be the PI, and for the trainees to get involved in. And it's essentially looking at how we manage parastomal hernia. I haven't got time to go through all of this, but essentially we don't know who to operate on, when to operate, how to operate, and when we should just treat conservatively. I think is the best summary of parastomal hernia treatment. International prospective observational study to get some more evidence on that, and to try and work out really what we're quite novel. We are not asking anything from the site, the nurse, the surgeon, beyond 30 days. We just ask the kind of short-term stuff, and the patient tells us into the long-term, online, in their native language, whether it works or not. We're not looking at scans because we ignore them as clinicians, and it's that area where the patient knows the best. And as you saw at the beginning, it's co-designed and co-led by a patient. There's several parastomal hernia operations. So we're not doing anything that normally the studies do for parastomal hernias. And as I said, the methodology has been hard to get sorted out in terms of the international data governance, the Colorectal Guardians, us working out how to interact with the patients online in an automated way. But it's now sorted. And what we're doing is getting patients who have parastomal hernia. They don't have to be having surgery, they can just be having exercises and support garments. And we're putting them into the study. The clinician or the nurse tells us the short-term stuff. Well, they're really good at this. We've done this in lots of our big audits. They'll tell us what mesh, what size, where they put it, what stitch they used. Really kind of granular detail about how they try to treat it. And then after that, the patient tells us everything else. We directly interact with the patient through an app and through kind of MyCap. As you'd expect, some stoma impact scores, but also MIMOP, which a few studies are using now. It came out in rheumatology about 20 years ago, Measure Your Self-Medical Outcome Profile. So that's when you ask the patient why they're seeking treatment, for what they want to get fixed, and then you ask them a year later, or 2 years later, or 5 years later, did you do it? Recognising that a lot of conditions we treat, whether it's hernias or hemorrhoids, affect people differently, and they seek treatment for different reasons. So in this, you personalise your own primary endpoint, which is quite cool. Hard to analyse, but you can do it. And decisional regret is a really key thing for lots of patients having this kind of operation. You can't see that. There's some standardised decisional regret scores which exist, and I encourage you to use them. And that's the MIMOP, which I've already mentioned. It's got a Twitter, there are mugs. It's on the Associate PI scheme. It's just about to get going in English, and we're doing our first SIVs in the coming weeks. A different study, this is something that's about to launch. This is based on this system called IVD Surgical, which some of you may have done. There was one Welsh site did this, got through the governance, congratulations to whoever it was. This was the idea that we want to get patient-reported outcomes for all of our operations, all of our outcomes in a prospective manner. We're starting because they're mainly younger patients, have a really good handle on this. And they get around some of the biases you can read there about clinician-derived cohort studies. So that system didn't work very well for a variety of reasons. And what we are currently designing, and at the late stages of, is a prospective study for IVD outcomes. It's called proboscis, which everyone hates. That's why it was in brackets on the first slide. The elongated mammalian mouth parts of the sucking apparatus from an insect. So we need a better name, I agree, but it's patient-reported outcomes after inflammatory bowel disease surgery. And one of the key things we're trying to do is get patient self-enrollment. The NHS is panoramic in our future health. These big direct patient approach studies where you don't have to go through trials, you don't have to go through a hospital to get into research. So we're trying to get that through in that way. ODP, Open Data Platform, is the MIHR system for how it manages data. And I don't know if you guys heard of it. It does exist in Wales. I checked this week, and I bet the trials unit use it all the time, but not many other people do, I would wager. Certainly that's the case in the UK. It is accessible as of yesterday to anyone with an email address as a result of us asking the questions. So you can get into it, and I would encourage you to do so, and I'll show you why. So you access it through the ODP system. Apps within there, one of these on the Associate PI scheme, which is useful if you're a trainee or if you're a trials manager, or if you want to see what opportunities you can help with your colleagues to see what studies are open, where the gaps are for the Associate PI scheme. One of them is called All Portfolio, and what it allows you to do is go in and really drill down as to what's going on. And why would you want to do that? Well, a couple of reasons. It's easy to use that look, so you can select just your country or just your region. You can select what specialty you're interested in. Live information updated every day. I think it's useful as a clinician if you're thinking, I want to do some research, what can I do? If you go on here, you can see what's being done across the country, find the biggest recruiting trials, and you can see, well, if they can do it, I can do it. And you can figure out from that. You can also see what's open and what's not got any recruitment in your area that may be of interest to your patient population. It's mainly useful to be able to, sometimes I like to look at the West Midlands one and see how on earth Coventry is doing so well, what are they open for, can I open for that, because it's clearly, sometimes it's hard to know, there's so many things going on, you can't quite see the wood for the trees. And I'd encourage, obviously, anyone thinking about wanting to open for research to get a password and to watch, and you can also reward yourself by looking at your numbers and your graphs and see the change over time. So I'd use ODP. Final thing you do, this is not Rossini 2, but you can get these nice heat maps as to where the sites are and how big the circle is and how many patients they've recruited to see where your spread is. And as a trialist, I like to look and find an entire part of the country that's not open for one of our studies and try and work out why and see if we can directly promote or directly approach that to try and get good national representation. Final bit, one more minute and then we're done. ESCP has got some similar research stuff to what Jim was saying about the ACP, so the European Society of Clinical Cardiology. On their research hub we've got the international trials map, which shows, you can hover over these route planner type things, and you can click and it'll tell you what studies are open, what disease condition they're in, and you can find out what's going on to get involved with, but also to see what results are going to be coming out soon. The other thing we've done with ESCP is lots of prospective red cap based international audits. And if you don't want to do any research, or your hospital's too busy for that, you've got no more research nurse capacity perhaps, but you've got trainees or colleagues who want to do something, these prospective studies are an interesting place to start. Our current project is the fecal incontinence audit, and there's there's a video explaining what we're doing and why we're doing it. It's open till the end of this month, to the end of February. And final slide, and Jim's alluded to some of these things, these international national audits often lead into RCTs. You can see the fecal one there is ongoing, it's really exciting. These other areas are currently in design at the moment for big international prospective studies that will hopefully be of interest. I'll finish there. Thanks.